The Ebola virus disease remains one of the world's most feared infectious diseases, known for its high fatality rate and rapid spread through contact with infected bodily fluids. More than a decade after Nigeria successfully contained its first Ebola outbreak in 2014, health authorities are once again on alert, following reports of renewed transmission of the Bundibugyo strain in parts of the African continent. The Director General of the Nigeria Center for Disease Control, Dr. Jide Idris, says a recent dynamic risk assessment conducted by the agency indicates the risk of importing the virus remains high.
The idea is not to allow that thing to come in. And what have we done? There was an entry protocol that was released to the agencies of government within the airport there, signed by the Minister for Health. We've activated that any flights, especially from those areas coming, passengers must be screened before boarding that flight. And they must complete the health declaration form that have specific questions.
According to the NCDC, factors such as increased international travel, cross-border movement, and similarities between Ebola symptoms and those of malaria and Lassa fever could complicate early detection efforts. To address these concerns, the agency says surveillance systems have been strengthened nationwide, while emergency response structures are being placed on heightened alert. The NCDC is also urging state governments to activate preparedness plans and called on healthcare workers across the country to maintain a high index of suspicion when managing patients with symptoms consistent with viral hemorrhagic fevers.
A case, you miss a case. And as I said now, and getting our own facilities ready, including the states. It's not all laboratories that can test for Ebola. What we've done is that we've earmarked some specific laboratories. Here, they have the capacity to test for it. NRL in Abuja have the capacity to test for it, right? There's a laboratory in Luth, that's where the first Ebola case was diagnosed in 2014. I think NIMA has the capacity. Now, there are 2 or 3 private facilities in Osogbo, SGID, right? I think there's one in Kano, a relatively new one that have genomic capabilities, Kano. So all those are there. There are some zonal laboratories that can just merely test molecularly, that can give an idea. So once those ones do that, samples are now taken to those labs where they can be confirmed.
While federal health authorities coordinate national response efforts, healthcare institutions are also reviewing their emergency readiness. At the University of Abuja Teaching Hospital, one of the country's major referral centers, the management says lessons learned during the COVID-19 pandemic have helped strengthen infectious disease response capacity.
You've seen the IDC, Infectious Disease Center. That Infectious Disease Center was built during COVID-19. Resources mustered together by Nigeria Center for Disease Control, built within our area for us to manage. It means we have the human resources, we have the experienced manpower to run it. This is the collaboration, inter-agency collaboration that is at the highest. Our isolation center is very ready for us to isolate, make diagnosis confirmed by the National Reference Center, and then we can actually say patient had that. It means that the turnaround time at each stages of detection, prevention, diagnosis, and treatment is all covered, and that is something the federal government has actually put in place.
The management also explains that designated isolation facilities remain available, while stocks of personal protective equipment have been maintained to safeguard frontline health workers. The hospital is also working closely with state governments, emergency response agencies, and public health authorities to ensure a coordinated response in the event of any suspected outbreak. For a country that successfully halted the spread of the Ebola virus in 2014, this current threat is a reminder that disease outbreaks know no borders. However, the concern now is to ensure that surveillance, preparedness, and public awareness are strong enough to detect and contain any potential case before it escalates into a public health emergency in Nigeria. From Abuja, Victoria Longjohn, Channels Television News.